After the anatomic region of interest is isolated in a process called segmentation, using the source data from CT and MRI, we create a 3D file of the patient's anatomy. This file is used to create digital, virtual, and physical models to allow for comprehensive procedural planning, as seen in this clinical case. In this patient with double outlet right ventricle and pulmonary stenosis, we used all three modalities to assess for feasibility of a biventricular repair. Using open source software, we can design the potential baffle and assess the pathway of blood from the left ventricle to the aorta. By manipulating the model on screen, we're able to evaluate for any potential causes of left ventricular outflow tract obstruction. These files are also imported into the virtual reality space to give the surgeons an immersive understanding of the patient-specific anatomy. In addition, these files are used to create 3D printed models in soft, flexible materials. The models are also created to scale, allowing the surgeons a more realistic assessment of the intracardiac structures. In this particular case, both the cardiac model and the VSD patch were printed to evaluate feasibility of baffling the LV to the aorta. The flexibility of the materials, as well as the ability to print to sub-millimeter thickness, allows the surgeon to evaluate potential ventriculotomy sites, as well as sites for anchoring sutures. In addition, the surgeon has the opportunity to preoperatively evaluate the size and shape of the patch needed for these most complex biventricular repairs. After creating more than 120 clinical models to date, we have learned that using complementary 3D visualization techniques can provide comprehensive procedural planning for patients with congenital heart disease.